Hi, and welcome to Mom Boss Chronicles. We are your host. I am Jen.
I'm Sue.
And we are empowering and inspiring people through meaningful conversations. So make sure to like and subscribe to listen to great content weekly.
Welcome back to Mom Boss Chronicles. We have two special guests here today, Dr. Danielle Biggs and Dr. Corinne Espinosa. They have just created NuGen Medical, which is a very cool, innovative, progressive, so a word I want to use to describe it, essentially a collective that you guys are focusing on to betterment of wellness, women's health, which I was reading through everything that you guys had done in our questionnaire about women being heard.
Yes.
You know, and I feel like that is such a big issue. I mean, my own friends, I'm in my 40s. We're going through perimenopause and the issues that my friends and I are all going through, and it's being dismissed. And so, I mean, I know you both have very extensive background in ER. So making that transition over, how has it been so far?
It's really exciting. Yeah. It's really exciting.
It's been a lot of fun. And the patient, like you said, getting to talk to so many patients like you, women in their 40s, 50s, who have been like, I went to my doctor and they threw me a starter pack and said, hey, try this. Or another patient said she called her doctor and was telling her symptoms. They're like, yep, you're 43, that's how you should feel. Like,
that's normal.
That's what's
Welcome to being a woman.
Yeah.
Yeah, and we've had like lots of conversations with just friends, neighbors, being like, who do you go to? Who do you talk to? And I'm like, wow, like we're surrounded by all of these like intelligent, successful women, and they do not know where to get or how to get good access to care. And that's kind of like where this came in.
Yeah, because it's not as easy, right? Like, I mean, as if you were having a normal practice, right? You're beholden to insurance or, you know, those guidelines. So being able to actually sit down, right, longer with a patient and really dig deep into the issues at heart and have a more curated.
And I feel like traditional practices probably don't offer some of the things you guys offer,
Oh, absolutely.
right?
Yeah.
Because I feel traditionally you would go to your doctor, you get blood work, and then there's medicine for high cholesterol. There's medicine, you know, if you're feeling a certain way depressed. But you guys offer alternatives to that, right?
Right. And the goal is to kind of do these things ahead of time, right?
Yeah.
Because we're just giving Band-Aids, right? Medications for all these things. But if we can kind of get ahead, that would be fantastic, right? Make people feel better. And we discuss this, and I'm sure we'll discuss this later. It's not just about like having so many more years left of life, but you want good quality
I love that.
years.
Yes.
Like, who wants to be stuck in, you know, bedridden, having someone take care of them? And eventually that might happen, but you want the most quality of life throughout life.
Yeah.
Right.
Especially in our 40s.
Early.
Yeah,
definitely not 40s.
And listen, career-wise, I feel like I'm just getting started.
Yes.
And quite frankly, I mean, you two guys too. Like, you're pivoting in your career and going after what makes you tick and having a more authentic approach to your life. So, I mean, like, no, now is not the time for us to be feeling old and decrepit and, you know, not...
Or
mentally well, you know, like all
Yeah.
of those things. This is a time where we really need that strive, that focus, because I'm like we're raring up to go.
We're ready to go.
Yeah, exactly. So for any of our listeners, we're in New Jersey. We live in Monmouth County, and so we record out of Bellworks. And you guys just started day one.
Day
with
one.
Your
So
space
cool.
in Bellworks. So if anyone
cool.
is in the area, they do have space here in Bellworks. And then otherwise, you guys, how are you working with patients so far, and how are you getting patients?
Yeah, so telehealth. So we've been telehealth for about a little over a month now.
That's awesome. Telehealth, right? Like,
it's so
what an
nice.
all
It's
new
so cool.
world.
Different.
Like, yeah, you
Yeah.
could meet somebody in their home.
Yep.
Like, and you're in your
we
office.
have.
Yeah.
So basically, you know, being moms, between us, we have 5 girls.
Oh, I love that.
Yeah.
Girl power.
7 months to 7 years.
Wow.
So the whole spectrum. So we know what it's like to have no time for yourselves, right?
Yes.
So I think the telehealth really allows you, you have 2 hours in the morning when your youngest one is in like their 2 or 3 hour preschool and your other one is in regular school.
Yeah.
You have an hour at night when you have to yourself. And so we have hours all over the gamut,
That's awesome.
all days of the week, just to accommodate. Like our motto is like, it's on your time, like your care on your time, because we understand how valuable that is. I went to a primary care doctor appointment, embarrassed to say, for the first time in a while last summer, and my mom came down, she had my kids, and I go, and the doctor was kind of like, so what are you doing here? Like, you're a doctor.
You're like,
And I'm
what?
like, yeah, but like I want an objective look at me.
Sometimes a doctor needs a doctor.
Yes.
Like, I'm
Yeah.
trying to not do that thing where I'm my own doctor.
Yeah.
And she was like, okay. And it was a very awkward interaction.
I can
She was
imagine.
basically like, what do you want me to order? Like, and I was like, wait a second. I just had my mom come down, watch my kids.
Like, I took
for
out time.
absolutely nothing. And I was like, wow, if I'm as a physician getting this type of care, what kind of care are
Right.
most people getting?
I know.
Yeah.
It was
Which is
very
why I
eye-opening.
think a lot of patients go years without seeing their doctor
Yes.
because they're like, I don't know what happens when I go. They just order blood work and I don't know.
and-
Like they
and
don't feel like they're getting value.
No, I mean,
Yeah.
perhaps I feel like a lot of times people may not know the right questions to ask,
True.
right? Like, these are the issues I'm having, but I don't know how to articulate, what
Yes.
it is that I need. I don't know what I need. So, yeah.
Right.
Yeah.
That's That's insane that you had that type of...
That was a reality.
Yeah.
Yeah.
But I think it's a real reality for
Yes,
most
it
people.
is.
And that's what ends up happening when we get our patients in the emergency department. It's, I don't really know what to do next, or nobody's listening to me, or, I just felt shooed away. And it's disheartening.
Yeah.
It's
So you guys
really
both work
disheartening.
in the ER?
Yes.
Wow. So you must see everything.
Everything
Yeah.
plus.
Yeah. So in the ER, I'm sure you get people come in with all types of gamuts of issues.
Correct.
And is that where then you were like, we should do something, like have a space?
Yeah, I mean, I think that it's hard sometimes to see our patients the way that we see them, right? It's an emergency department.
Yes.
The majority of people are coming with emergencies. So to be able to step ahead of, some of the complaints or some of the concerns that we have and address maybe some of the issues that they've had for a long time that they can't verbalize, it was just awesome to kind of like start there.
To
and jump
pivot.
in.
Yeah.
To pivot. For us too, I think it provides I don't know, it's just a different experience for us to talk to patients on a different level.
Yeah.
I
Right?
guess it's probably nice to be, like you said, proactive as opposed to reactive.
Right,
When
totally.
they're coming into the ER. I can only imagine how much that frazzles. Like, you're trained,
Yeah.
but your nerves, right?
Yeah,
when
on
you have
edge.
folks coming in with
Absolutely.
serious issues that need to be addressed immediately.
Yeah.
And I also think we have a lot of women. I'd say a lot of our patients who are women who come in between the ages of 35 and 65, and they have a lot of these vague complaints. Like, I just don't feel well. I have hot flashes. I'm tired. I'm
Yes.
taking naps. Like, I have no libido.
Or gaining weight, I'm sure.
Yeah, I'm gaining weight, and I exercise every day. Sex has become painful.
Yeah.
Like, all things that they may not even be comfortable talking about.
Yeah.
Like, they get brought up to the emergency department. And in the emergency department, you're coming at the limit of okay, I'm going to rule out anything life-threatening. I can give you the people to follow up with. And then people kind of leave okay, I had all this stuff done, but I still don't have answers. I still don't feel better.
Yeah. I guess
you-
I'll just go back to life.
Right, and, then they never follow up.
They never
and
follow up.
and
Yeah.
they get kind of lost in that. So
Yeah.
it's really nice to kind of be catching this group of women, especially, who are okay, we got you. We can help you outside the emergency department. We have suggestions.
Right.
I love
We
it.
can talk about those things that in the ER, we're in the room with you for 10, 15
I know.
minutes,
Yeah.
Now we're on these consultations and we're on the phone with you for 30, 45
And you can
minutes.
go in depth.
They're getting comfortable. They're opening
Yes.
up to
Yes.
us. And sometimes what they really are, the concerns, are come out kind of toward the end.
Yeah.
People
Right.
are
Well,
embarrassed.
I'm sure some are, exactly.
Right.
Yeah, it's hard
So
to
I've
be
really
vulnerable.
enjoying that part of it.
Yeah. And what are some of the things that you guys do offer? Like you do IV therapy, right?
So we do IV infusions, vitamin infusions.
That's
right?
awesome.
Peptides are huge at this point.
What are peptides?
Do you want to do it? Because you got a great spiel. She's like all about this.
I've heard of it, right?
Yeah.
But what is peptide?
So there's you need them.
I'm sorry, once you start, we're all right, what else am I going to try? So there's a really big pitch right now for pro-aging, longevity, because people don't want to end up in the emergency department with things that you're just at this point mitigating.
Yeah.
So there's this huge push in our society for proactive care, and peptides are part of that. So your body's all built up of proteins. Little proteins get together and they make these peptides, and they're part of signaling pathways. So different peptides do different things. Some are just for general pro-aging, just feeling better. Some are for muscle building and better recovery. Some are for actually MSK issues, like a torn rotator cuff, but you don't want to have surgery. There's peptides that help with healing.
Oh, wow.
I didn't know that.
Yeah,
Okay.
it's pretty
Yeah,
amazing.
cool.
BPC 157 is a really big one for
Wow.
that. There's peptides that target belly fat. I've had 2 C-sections.
Wow.
All the Pilates and salads in the world are not helping.
I'm
me.
trying so hard.
Same.
So tesamorelin is a really great peptide. It actually targets belly fat.
Oh my
so
gosh, I'm
cool.
coming down right
Yeah.
That's amazing. And so we have a lot of people on that. We have a lot of people who are exercising. People will combine them. And a lot of people don't realize it, but weight loss meds like tirzepatide, which people more frequently know as Mounjaro or
Yeah.
Zepbound, those are peptides. They're just more commonly known or used. And people also don't know is that you don't have to just use them to lose weight.
Right.
They have amazing cardiovascular protective properties.
Yeah.
They help with glycemic issues. So once you lose weight, or even if you don't have to, you can actually microdose the peptides.
That's so cool.
Just to get like the pro-aging, anti-inflammatory components
so
of it.
cool.
Oh, I love that.
Yeah, it's pretty amazing.
I didn't know that. Okay, cool.
I feel like I learned so much right there. Peptides. I feel like I see peptides in like makeup stuff sometimes. I have like eye cream that's peptides, but I don't know what that is.
Yeah.
No, there are, and some of them are injections, some of them are oral, some of them are topical. Like probably one you're talking about is GHKCU.
Yep.
And so that is the topical ointments. There's scalp treatments for people for hair loss.
Oh my gosh.
And then there's injections too, which help with like the elasticity of your skin,
Right.
stretch marks,
So
wrinkles, things like that.
So peptides sound awesome.
Peptides are awesome.
That's the problem. It's what's next. Which one are we doing next?
Yeah, that's cool. So the IV infusions, those help if you're depleted, if you're not feeling well?
Yeah, so we have a few different ones, and it's really based off of what you're looking for. I mean, we have ones that are great for hangovers.
Yeah.
Oh, I can imagine, right?
Yeah, like a little migraine cocktail. We get a lot of patients in the ER that just have a migraine. They just need a little
Especially
something.
now, like
Yep.
I find, I guess, because I don't know if we break down alcohol as we get older,
I
but
can't.
after some wine, where before it wouldn't affect me, the next day I'm really hurting.
We were just saying this
Right,
right before this.
I
Like
don't
one
even
glass of
like
red
to
wine
drink-
is like,
I don't even like to
Uh-huh.
drink at
Yep.
all anymore because you pay for it the
Yes,
next day.
exactly.
Or at night, or you don't sleep.
Yeah,
The
and
sugars.
IV infusion sounds like amazing. Then
So what's like in it?
So it depends. We have all
Okay.
different ones, right? So obviously for a migraine cocktail, right, you'd want something, other than the fluids, you want
Right.
something to kind of break the effect of the headache, right? So we have different components there. We have ones that have vitamin C. What else? Zinc.
Yeah, the Glow Up is a
Yep,
really
the Glow
popular
Up is
one.
good.
That's
What's
a big
that?
one. So that's one to just kind of like revitalize you, replete all your vitamins. It has like B complex in it,
I like
vitamin
it.
C, glutathione.
is it
which
good
really
if, like
helps with
before an
recovery.
event, and, like if you
Yes.
want to
Yes.
like look
Yeah.
like
Oh,
a
yes.
wedding, right?
Yes.
Like
Yes.
my sister's getting married
Exactly.
in October, so
Yes.
maybe I want to have
Yeah,
right?
absolutely.
And I love the name Glow
Glow
Up.
Up.
Yeah.
I
Glow
know.
Up. We actually put one together for like women who are maybe it's that time of the month.
Oh,
and,
yeah. And
you
you're
know, it's
feeling
coming,
off.
You're
Yes.
feeling terrible. You have
Yes.
cramps. Like you're nauseous.
Yeah.
So we put together the Harmony infusion,
Oh my gosh.
which basically the Hormone Harmony infusion we call it, which is kind of get you over that little hump, maybe your worst day. The Be Better complex is another one. We also have one if you're sick.
Oh,
time
like if
that
you're
you
feeling
for viral
off.
Yeah, it's just feeling
illness,
off.
not
Yeah.
feeling
Yep.
well. So they have a lot of cute names, but they basically contain IV fluids and lots of vitamins. And a big one is Toradol, which is basically like a miracle drug, but it's ibuprofen in the IV.
Okay, awesome.
And it works awesome. It's an anti-inflammatory. It helps with pain.
Oh my God, amazing.
So we have that in like our headache one and our Hormone Harmony one.
And do people feel good like pretty quickly, right?
Amazing.
Because it's, right,
right?
it's going
It's-
right into your
And how
veins.
long are those like infusions about? Like
They're 30
20
minutes.
minutes.
not,
Yeah.
like not a crazy commitment.
No, you really
Yeah.
can kind of run in and run out.
On your-
That's very
on your
nice.
lunch
And then
break.
lunch break.
Yeah.
Yeah.
That's awesome.
That's so thoughtful. I have never. I mean, I've heard of some people like with the IV for like hangovers. That's
Right.
really more
Totally.
the
Same.
one
When I think of that,
But to
yeah.
think of like a more,
It's very
Like curated,
focused,
yes.
right? Like focused to what patients need.
oh my
The
gosh.
glow up. I'm coming in for the glow up.
Yeah, glow up.
The peptides
The
for
harmony
belly.
one. Oh
Yeah.
my gosh, could definitely use
Anytime.
that.
But then also like the hormones is a huge thing.
Oh
that-
yes, so
Right.
can we talk about
Right.
hormones?
Yeah.
So our hormones obviously fluctuate in our life, right? From
Yes.
when we hit
Oh, yeah.
puberty, and that's just the way we are built, right?
Right.
It just and you guys are here to help customize.
Yeah, so basically, hormone therapy should be a must for
Yeah.
99%
A must,
of
right?
people.
Where I feel like
right?
people, like in my mind, it was like, oh, a luxury or a wishful thinking, but you're like a must,
It
right?
should be a must.
I know.
There was a study done like years ago that basically said hormone therapy can cause cancer.
Oh.
And everybody flipped out.
I know what you mean.
And no
And
that
one
was
stopped
it.
prescribing
Nobody prescribed it.
That,
at
they
all.
were done.
Yes.
Yeah.
Yes.
Because it's women,
Of course
they
it's
don't
true.
do
No,
further
no,
research on
exactly.
us ladies.
Research
Yeah.
stopped right there.
Yeah. Yeah.
And so basically, now there's been studies that's actually not true at all.
Yeah.
Depending on whether you have a uterus or not, depends on which hormones you need. Some women even need testosterone. And so our goal is to really find out like what are your symptoms,
Yeah.
and then what do you need based on your medical history, based on medical history of your family, based on your lifestyle, what your particular symptoms are,
Your age, all of
your
it.
age.
Yes.
So it's found that starting hormone therapy in perimenopause is
Yeah.
actually the best time to start it, because as you get older and your estrogen levels decrease, which causes menopause, you have increased risk of heart attack because estrogen is actually cardioprotective.
Oh, wow.
So that's why women, once they go through menopause, have a much higher risk of heart disease, high cholesterol, diabetes. All these things start coming up because your estrogen levels went down. And so by going on hormone therapy, you actually can prevent cardiovascular disease, prevent osteoporosis, actually prevent some cancers.
Wow, that's so cool.
Prevent colon cancer. Like it's kind of amazing.
Yeah.
And people have just been told, oh yeah, you're perimenopausal. That's how you're supposed to feel.
Exactly.
Yeah.
Yeah.
No one
Here's
does
birth
not
control.
supposed-
Right. That's what I hear all the time.
Yeah. Want to regulate yourself? Yeah, go on the pill. Yeah.
Right.
No.
Yeah.
And honestly, perimenopause, some of the first signs are irregular periods.
Yeah.
And then just like lack of sleep, or maybe like having a hard time sleeping, needing naps during the day.
And
kind of joint
perimenopause
pain.
is like, it could be anywhere from like 10 years, right?
Yes,
Yeah.
it's a
Like,
long time.
it's a long
not
time.
just
Yeah.
a couple of years.
No.
It's like 10 years prior, whatever,
yes.
right? Like
Yes.
people can get it
Yes.
in their 30s even.
Absolutely.
Yeah.
Absolutely.
Mine was like it was rage.
Well,
was
you've
straight
noticed,
up. Yeah,
like,
definitely.
yeah.
It was insane. It was unusual. I mean, I can
You're
have
like,
a temper.
something's off. Yeah.
But like, it was like really, really bad.
Yeah.
I did the Dutch test and like came to find like my adrenals are all crashed. Like cortisol is actually really low. But like the person that I spoke with, I started taking more like B complex vitamins, and that was helpful.
That helps
but like
with the rage.
I was like, I'm not going to go to the gyno. She was just like, oh,
It's okay.
Yeah.
We hear a lot of that in the patients.
So how do you guys
who wants to
screen
live
for
like
the
that?
hormones? Is there certain tests that you do or recommend?
So everything about us is trying to be very comprehensive, right? Other than getting the history and finding out a little bit about the symptoms, it's also important to do the lab work, right? To kind of see where they're at. And just because the lab work isn't menopause, right, or totally perimenopause, that doesn't mean that they can't start to develop some of the symptoms that they're having.
Yeah.
So we really focus on, other than the typical blood work, right, like CBC, CMP, checking a thyroid, because thyroid problems can, cause some of these problems also. We're going to look at all those big hormones. So your testosterone, your estrogen, your progesterone, and kind of go from there.
Yeah.
Right?
And it could be different for
And everyone's different, right?
Yes,
Like,
yeah.
just because we're the
Yeah.
same age doesn't mean we're going to need the same treatment.
Yeah.
No, not at all.
And that's
on
like
one
right. It was
size.
crazy about that recommendation of just take birth control. It's not no one size fits all. Everybody's different.
Yeah.
Right? It's like your own fingerprint. Everyone's got their own unique.
Yeah, and I notice, and I wonder if this is normal. Some months I sleep great, I'm good, and then other months I feel like I have an insomnia, and then like some months I feel like the water weight's coming off, I'm good, and other months I'm just like dragging an extra 5 pounds. Is that like as you go through perimenopause, can it go through like waves?
Yes,
So
that's exactly it.
That what you just did is like if you show a chart, like a medical chart of perimenopause, your estrogen level goes like this.
Wow.
So sometimes it's okay.
Wow.
Sometimes then you think you're crazy.
No,
right?
you're not.
like-
But people will tell you you're
Yeah.
crazy. That's
Right.
what the problem is.
Yeah.
Another like really alarming thing is that when people go through perimenopause and menopause, like their rates of depression and suicide actually skyrocket.
I could see
I
that.
can see that
because it
for
affects
sure.
your mood too.
Yeah.
Because sometimes I feel like not wanting to go out or do anything, and I've read that like a lack of like motivation or a lack of wanting to be like social can be perimenopause. I'm like, that's not like me. I'm
Yeah.
very social. I'm like sometimes I'm like, this is so weird that I have like anxiety about going, but that's just
It's part of it.
the hormones, right?
right.
Yeah, and I could see that like the being so depressed, like when things start like crashing and changing.
Yeah, and it's all treatable, right?
Yes.
Like I feel like especially like as you're going into your 40s and your 50s, like your kids are getting a little bit bigger. You're starting to get like your life back.
Yeah.
Right? As you're starting to get your life back,
Yes.
you start to feel like crap.
We're hitting our stride in some way, and like it's like just kidding. I'm gonna pull the rug right up from
Yeah.
here again. Yeah.
Exactly.
So I remember when I was younger, my mom was very open, and she had a really tough time with menopause.
Well,
and
she would talk about it?
Yeah,
That's
I mean,
awesome.
not like in depth, but one of the things she did share with me was painful sex, and it was a big issue for my parents, but I didn't really like understand it at the time because
Yeah.
I was like a teenager.
You're like,
I
what?
can't, in my brain, I just couldn't wrap my head around it. But I've talked to other people who said like as you grow older and you're going through menopause, and it's essentially like can you guys explain it? Because someone was telling me, and I was like, that would have never occurred to me. I didn't know that if someone else didn't tell me about it. But that's something that's really serious. We need to consider. So I'll put it over to you guys.
Do you want to say, or you want me
Sure,
to say?
yeah.
No, it doesn't matter. It's really just relative to the hormones, right? The estrogen. We need we've had these high levels over time, and as they start to go down, you start to see signs of like decreased libido,
Yeah.
right? And then all the normal GU functions, right? So women aren't as lubricated as they used to be.
Right.
The desire is down, and then unfortunately, there's a mental game that kind
yeah.
of plays into this, right? Because you can sense your body's off. You know that your partner might sense that your body's off, and it becomes this vicious cycle, right? So if we can kind of address it up front and kind of give those treatments, and the treatments can also be local treatments, right? Like different creams and ointments to kind of get that libido back, right? Get you feeling the way that you want. It's very natural to want to be intimate with your partner, right? So to take that out,
feel
you're
sexy.
really you're missing a big component of the relationship
It
that
is,
you
and
had.
that's a major, like a feminine energy, right? We
Oh my
talk so
God,
much
yes.
about like the feminine energy. That's part of it. Is feeling sexy and like physically loved like that. You know?
And it's true. And unfortunately, a lot of women don't talk about this, right? Like a lot of women wouldn't share, oh, my libido's so down, or, you know, I'm very uncomfortable when I'm having sex. And that's a shame, right?
Yeah.
Because then those symptoms aren't addressed. And the likelihood is your friend might be feeling the same way.
Right.
So being open about this is something that we really promote when we kind of talk to the patients.
Right.
Like, just tell us what you need. Tell us what's going on, because we can fix this and make your life, you know, have more quality.
Which is so important, right? Like, I think quality of life is so important.
Right.
I hope, and I think our generation is a little more comfortable being open.
Yes.
You know,
Yes.
I think it's
Yes.
definitely the older generation. And you didn't talk about those things at all, you know. It was just, that stays in my own house.
Because you were afraid of being judged, I guess, something. They just kept secret about
Or
it.
you think you're the only person.
Yes.
And you're like, why? I'm the weirdo here.
Yeah.
I'm the outlier, you know, and it's like scary to talk about. But it's so common. So if you're listening out there and you are experiencing that, talk to somebody about it, because you're not alone. It's pretty common.
Yeah.
And there's a lot of things we can do. Like, there's vaginal estrogen alone,
Oh, that's so cool.
which you can use. There's vaginal testosterone,
Didn't even know this.
Yes.
Oh my
which
God.
is amazing. Increases your libido and helps with it. Like, and as like, not to get graphic, but
I know.
your
It's
skin,
like how-
your skin,
yes.
like, as medical people, we feel
Yes.
comfortable saying everything.
Yeah.
But I don't know. I know. I don't.
No, go for it.
That's why I kind of held back.
Real talk.
Y'all need to hear this, because it is the
Skin
truth.
gets thinner,
Yeah.
and that's why things become more
Right,
painful.
painful.
And like Corinne said, like, you don't make this, like, you know, your natural lubrication is not the same.
Right.
And then also women tend to get more frequent UTIs.
Yes.
Because the way your anatomy kind of changes, like your different parts come closer together.
Really?
And it can cause
Okay.
more frequent UTIs.
I didn't
so
know that.
all of that contributes to like GU issues in perimenopause and menopause, which is a very true thing. Menopause is just like the day that you have had no period for 1 year.
Oh, wow.
That is the
That's the
actual
definition.
definition
That's that
of
moment.
menopause.
Yes.
1
Okay?
year. Yeah.
That's what it means. So you have this 10-year span of perimenopause, early late menopause. Like, there's a whole span of like around an average of 7 to 10 years where people are not feeling right.
Yeah.
Menopause itself is 1 day. And so we are really excited to help people feel good for
Yeah.
Oh my
For a
God.
long time.
Yeah,
Right?
I know, because when I think of menopause and all that, hot flashes, and that's it. I'm like, they don't
yeah,
talk about the other
exactly.
side
Yes.
effects we've all
Right.
just talked
Yeah.
about.
That's it, just hot
More than
flashes.
just hot flashes.
Right.
Yeah.
Those are probably the most thing that makes people the most miserable,
Yeah.
honestly.
Right.
Because it affects sleep, it affects your day. And I even asked my mom, I'm like, how come you didn't do hormone therapy? And she's like, no one told me about it.
Where would you
Right.
go,
What
right?
do you
Where
mean?
she's like, where do
I thought that was like, that's what happens. You get that age, you go through
You deal
menopause,
with
and
it.
that's how you feel. You
Yeah.
deal with it.
Yes.
That's exactly what she said. She goes, you just deal with it.
Yeah.
And I'm like, I saw this meme, and it was like, if guys went through menopause, they'd have a vaccine for it.
1,000%
Yes.
truth. Actually, that like leads me to my next question. Is like peers, like your male peers. Are they supportive? Are they
Dismissive, right?
Like I'm just
I think.
not to throw anyone
So
under a
no,
bus,
no.
but just
So
curious.
I think our male peers
Very lucky.
are very supportive.
Yeah.
Like they
That's
love
great.
what we're doing. They can see the population.
They're an
that's
advocate
out
for it.
there,
Yeah.
right?
Yes.
But I think that it's very easy for men to say, "Oh my God, my wife." Oh my God, my mom. You know,
Yeah.
she's such a whatever,
Right.
right?
Yeah,
she
my
has such
sister's
an
being
attitude.
crazy. Yeah.
And you kind of just like you want to laugh, but you also want to be like, just shut up.
You don't even know.
You have no idea.
You have no
You
idea.
literally have no idea.
Raising children, you
Right.
know, running a household, a career,
Yep.
you know, contributing to household bills, and your body is doing
Yeah.
things you don't want it to
To
do,
do.
but
Correct.
it's doing it anyway.
Yeah.
So have some grace, you know.
Yeah.
Find the support.
I think in general, people are dismissive about it because they have been told to ignore it for so many
Yeah.
years, right? And if you as a woman are being told to ignore it, then your significant other is being told to ignore it
Yes,
too, right?
it's just conditioned.
It's conditioned, but we are lucky to the men that we work with, especially in the emergency department, are they're amazing physicians, and
They
they're
really
super
are
supportive. They've been
fantastic.
super supportive of what we're doing.
Right,
They love
right.
what we're doing.
I like to hear that.
And
I
so,
love that.
and our spouses too.
I love that.
Our
Our
spouses
biggest
are great.
cheerleaders. Our biggest cheerleaders.
Yes. And I think the beauty of social media is now you can get to an audience.
Yes.
Because before it was like word of mouth, but hopefully through social media, and the beauty of it is that you can reach more people.
Right.
And, explain these things and let them know, like, hey, you don't have to suffer in silence or deal with it.
Right.
Exactly. It's the social media part is probably the most challenging
This
part
is
for us.
very challenging.
Yeah, right.
That's why we're like, we have to go on this podcast because we have no idea what we're doing on social media.
No, it's true. Like we're, at the end of the day, we're like these nerdy doctors. School forever, studying
I love
forever, and
it.
like to do this whole social media presence and everything. We're like, we can do the
That's
medicine.
a different brain.
Yeah,
It's
right.
Oh, no, it's
Right.
a total different.
Yes. And
Yes.
it's like, how do you appeal to people? Like,
Yeah.
how many times do you post?
Ugh,
Are these
it's-
colors okay? What does this font look
I
like?
know.
And
It's
just
a science,
Why are we
apparently.
talking about
I know.
this? Like, we would never talk about things like
We
this.
just want to make you feel better.
I
Like,
know.
we know how to take care of
Yes.
you. The color of the post and how to do that.
If you need a social media person, I have one. Yeah. So, what inspired you to get into medicine?
So my journey to medicine was pretty long. I didn't do science. My parents thought I'd be a great doctor. Not a great doctor. No, they didn't. They thought I'd be a great teacher.
Oh, a teacher.
So
Wow.
that's how I started.
Yeah.
I come from a family of doctors. I was always interested. And then right before I graduated undergrad, I'm like, oh, let me just take some classes. Didn't know if I was ready. I did a master's in neuroscience and had a career in applied behavior analysis. And then finally, when I turned 30, I'm like, I probably should do something with my life. And I applied to med school. And,
Oh my gosh, that's
and
amazing.
that's what it was. And I started late. It was really weird to be in med school and people were celebrating their 21st birthday. And I'm like, you know what I was doing on my 21st birthday? Not this.
But now you appreciate, I'm sure, your profession so much more.
Definitely. I mean,
Yeah.
I had a lot of experience,
Yes.
right? So I think that it's just, I have a different perspective of my patients and,
That's awesome.
and whatnot.
Yeah,
Yeah.
absolutely. And how about you?
Her story is way more interesting than mine. I was the
No.
little kid who wanted to be a doctor ever since I was little.
Like you
There's,
felt it.
Yeah, there's nothing else I ever wanted to do.
That's so cool.
So everything in my life has been very goal driven of wanting to be a doctor.
I love that.
So I'm the first doctor in my family.
Yay.
So that's kind of cool. But yeah, everything I've done, every motivation has always been I want to be a doctor. I like science. I love taking care of people. I love I love one of my favorite things about our job is that you always have to learn something new.
Yeah.
You're never done learning.
Right.
And that's what's been so awesome about this.
This
All
is
of the
totally different brain.
pro-aging,
Like you're
longevity
into
is
it,
all
right?
new.
Yes.
Like if there's new research, you're into tell me more.
Yes.
Not like,
Yes.
ugh, I'm so and I want my doctor to be like that.
Yeah.
I don't want my doctor to be stuck in old school ways.
No.
I love that doctors are progressive and okay, as research comes out, let's pivot and let's talk about
Exactly.
this.
And
Like,
We're like, what podcast are you listening to?
I
You
love
know?
that.
And
Yeah.
so we're constantly ordering books and reading.
I love it.
It's fun. It keeps
Yeah.
you engaged. It keeps you going.
Your
And
brain
that's-
working.
Yes,
Yeah.
it keeps your brain working. So
And then,
sorry. They had a
so
you two.
yeah,
link
the
up.
ER, right? So the ER called you both, right? And then in the ER, you became friends?
So I met Danielle. I was a medical student, and she was in fellowship
I was doing
at that
ultrasound
time.
fellowship. Yeah.
And we just became fast friends.
Yeah.
How awesome. Instantly. Yeah.
And instantly. And then when I started residency, she left.
Right?
But we still kept in contact. And after that, she's like, I want you to, to come and work with me after. And I couldn't. It had been so long. I'm like, I can't say no. Again.
Yeah.
This was supposed to be that way. And then now we're kind of doing what we wanted to do on the side. We always talked about, let's do something else. Let's also have something else to kind of keep that other side of our brain moving. And now we're here.
Yeah,
So.
absolutely.
Friendship, business partners, mom's taking over the world.
Yeah, I'll take it. You can keep going.
I love it.
That's gonna be your slogan tagline. And how about your daughters? I mean, what an inspiration you guys are to them, and showing them that they truly can go after whatever it is that they set their minds to. I mean, so I'm sure they're your biggest cheerleaders as well.
They are.
Yeah.
They get dressed up in their doctor clothes.
Oh,
They're like, we want to come to work with you guys.
I love that.
They love it. We just
So sweet.
I think we just try to instill that you can do anything you want. You can be, my parents always taught me you can be whatever you want as long as you wake up every day happy.
Yeah.
Yeah,
So
so
I
true.
definitely try not to say you're going to be a doctor.
Yeah.
I don't actually talk about work that much at home with them, just because I don't want them to feel like this is what I have to do.
Yeah.
Like, I just want them to be happy. But they're ask us questions all the time. Like, they're so into it. Like, I've taken them to work with me on days I've just, like, had for conferences to kind of show them around.
Right.
They'll, like, visit me at work with my husband on, like, a long Saturday or something. And they are, like, when I grow up, I want to be a doctor. I'm like, you definitely can, but I just want you to be happy.
Yeah.
You're just proud of mama.
Right.
Yeah. It's
Yeah.
really nice.
Agreed.
So sweet.
I know.
So are you guys able to help patients across the country? Like our listeners listen all over because you do telehealth?
So we are telehealth in New Jersey just now.
Okay.
Yes.
Currently doing our licenses for Pennsylvania and New York.
Awesome.
Okay.
So we will be
Awesome.
tri-state
Because the way
soon.
medical works, I guess,
Yes,
right? Isn't that
yes.
funny? Like same, we sell
takes
real
time.
estate.
Yes.
We sell real estate in New Jersey.
Yeah.
If you want to sell real estate somewhere else, you need a license.
Yes.
So I get
Exactly.
it, but we can help recommend. Like, but yeah, I know what you mean. So you're in New Jersey, and then you'll work on expanding.
Yes, it's
Yeah.
just like a paper. It's honestly, it's just paperwork.
Yeah, I know.
So with your medical licenses, like we can get a license in any state.
Yeah.
It's just paperwork.
Yeah.
Fun,
So
right?
we're currently
Yeah.
working on the paperwork because we have had a lot of people reach out in New York and Pennsylvania.
Yeah.
Just from like family, friends, etc. So we're currently doing all the paperwork for that. So
Yeah, and as your business booms, I'm sure people are going to reach out to you from all over.
That's what we
yeah.
hope.
Totally.
Yeah.
Yeah, it's gonna become like my cousin in, Cincinnati.
I love that. I mean, I feel like people saying that they had a good experience with us and wanting, like, we've had a lot of people like, I can't wait to tell my friends. There's like no better feeling than hearing somebody say that.
Yeah.
I know. When you finally feel heard from a doctor, it changes everything.
Absolutely.
Yeah.
Yeah.
So, I mean, I'm so excited for your patients. I'm so excited for the work you guys are
Thank you.
doing. I feel like women need this. Like, we need doctors who want to hear us, who want to work with us, who want to try alternative, medicines and just make us feel better. So,
Yeah, and like a lot of questions we get are, how much is this going to cost?
I could imagine. Did you
right?
take insurance?
So we don't take insurance.
Okay.
Because once you take insurance, you're restricted,
Yep.
right?
I could imagine.
Of
I
what
know.
you can do.
On
And
what
I'm-
they approve.
Of
They said that you
course.
can't do this. I hate
Yeah,
that.
of
I know.
course.
I
Yeah.
hate
And,
that.
like, everyone is
The
different,
racket.
and we want to be able to provide you the personalized care.
Not just
That's
because your
exactly what you
insurance
need.
says.
Yeah, insurance says that I can
Yes.
give you this, but
But
not
not that.
Well, that's not really fair.
I know.
So
I
we,
get it.
We do not take insurance, but our packages are all inclusive.
Awesome.
So basically, depending on what your treatment is,
Yeah.
you know the price. That includes monthly follow-ups with us every single month.
That's awesome.
That includes all of your labs whenever you need them. That includes all of your medications, all your supplies. Basically, 24-hour access to us, however
Yeah.
you need. Like,
Yeah.
our app has a chat, and we respond
you guys have an
all
app,
the time.
too.
It's the electronic medical record.
Yes, that
But
has
you
that.
can message us
Communicate
on
with you,
it.
Oh, that's
which is awesome.
awesome.
Whenever
Which has
you
been
need.
great
But instead
because
of- yeah.
just like a little follow up, like how are
Right.
you feeling?
Yeah.
It doesn't need like a big
Have to be a big-
consult. It doesn't
right.
have to do
Leave a
that,
message.
right?
Yeah.
Yes.
So
Yeah,
that's
it
nice.
just kind of helps. And so there's no surprise cost.
Yeah.
We actually just purchased a 3D body scanner.
Yes, I know.
So that's going to be included in all the packages.
So cool.
whatever
Right.
treatment therapy you're doing with us, you can come here, and we're going to do your body scan and review your results, and you're going to come every month and
I love
track
that.
your progress, see where your
Yeah.
focus areas
And your
are.
health is priceless. Like, I know
correct.
sometimes it's like a big pill to swallow, like the thought of a cost, but at the end of the day, honestly, health is wealth.
It's an investment
I've
in
seen
yourself.
my friends,
Yeah.
pass away or go through illnesses, and at the end, that doesn't matter. Like, my health and being present with my family, that is the wealth.
Right.
Right.
So be able to take care of yourself, like, I feel like it is priceless.
Well, yeah. I mean, do you want to pay for it now
Yeah.
and enjoy what you have,
Right.
or do you want to pay for it later
Yeah.
when you're, really ill?
Yeah.
So
for
I would
sure.
choose the other option.
Proactive. Yes, agreed. Yes.
Well, it's so commendable what you both
Thank
are doing.
you.
Thank you for coming on today.
You're
for
on
having
Instagram,
us.
right?
We are.
Yes, we are.
NuGen.
NuGen
Yes.
Med, yes.
Yes.
So-
We'll,
So
we'll link
cool.
all that too.
Yeah.
That's why I think it was you that posted maybe in like Monmouth County Mom.
Yeah.
No.
And I saw it and I messaged you. I'm like, oh my God, come on. And we're also in Bellworks too. So,
Yeah. So follow NuGen. Check it out.
Awesome. Well,
Yeah.
thank you guys so much
Thank
again.
you.
Hope
Thank
you
you
have
for
a
having
great
us.
rest of your day. And thanks for
Absolutely.
listening.